This is Dr. Elo again um, in my show Caring for Your Health. And today is the 13th of January 2024. So today we're going to talk about aging and end of life. Basically, aging is a process where cells gradually start to die more than they're making more cells. So it's like when you have oxidation. Oxidation is like aging. Like if you look at this banana peel, you can see that in this banana peel, it is almost brown because it's going through what they call oxidation. Oxidation just means that it is gradually losing its power to maintain a cell. So when something is going through an oxidative cell, like a cell, the mitochondria and what it breaks down is gradually getting damaged and is not replaced like it used to. When you're growing, starting from the cell till in the womb until you get old at a certain age, gradually the cell turns to 2 cells, then 4 cells, then 16, and then goes through this mitotic division, and then you become a human being and gradually start to form organs and all that. If there's any damage in the DNA during those divisions, it repairs itself very quickly. And that is how the body is until the person is born and the person continues to grow. Every part of the body grows. You're making more cells than you actually, than the ones that are dying. At some time, they go into a balance. So your body is growing. Your brain, actually the brain continues to grow until maybe 20, sometimes 28, 29 years. It grows fastest in the first 2 years, and then the first 5 years, and then slowly continue to grow. And that is what cell division and growth is all about. The hormone helps go through all that. But then, at some point in your life, you get into a balance. So your body does not repair as fast as it used to. So basically, you're going through what they call aging. Aging usually starts at the age of 30. It's fastest for some people. It is slower for others. But in the end, you find out that most people, on average, at the age of 30, their cell growth and death are in a balance, and gradually, when you have injury or things like that, it takes more time to repair because you're not making as much cells as you used to because of gradual oxidation. So how do you try to prolong your aging? Some people, for some DNA issues, medical issues, if you have diabetes, if you have COPD, if you have congestive heart failure, if you have a stroke, if you have medical issues, that can actually affect aging. It can make aging go faster because you've actually changed some of the metabolic issues in your system. But then, how do you try to see if you can be able to slow aging? The best way to slow aging is to see if you can do those things that prevent you from having chronic disease. Because when you have chronic disease, it actually makes oxidative stress even worse. So you're going through aging faster than you should, and your lifespan actually decreases. So basically, there are things that you can do to help you with aging and make your aging slower. And the best thing is to do all those things that will protect you from having preventable diseases like hypertension, diabetes. Now, you have to understand that hypertension is the commonest cause of most of the diseases, whether it is congestive heart failure, whether it is stroke, whether it is diseases that affect you related to heart and peripheral vascular diseases, whether it is atrial fibrillation and all that. All these are related to hypertension, because when you have hypertension, you're putting too much stress on your heart, and that could actually affect your heart ability to function, and then it could fail. The same thing with diabetes. Diabetes makes you have cholesterol problems, increase your risk of coronary artery disease and stroke and all that. So basically, the next step is how do you try to improve your oxidation and extend your life a little bit. So we're going to do that in the next few minutes when we come out of break. Thank you. Back again after the break. Now we're going to talk about what are things you can do to slow down your aging. Now we've heard of exercise, and I've talked about exercise a lot, and we've talked about what are the best exercise to do. I know that you've heard that tennis is the best exercise to do because among all the sports, it is the one documented to have the highest lifespan of all sports. That's why most of the tennis players are still alive. And together with badminton and pickleball and all the softballs that people play, they don't cause too many injuries. I mean, tennis can give you too many injuries, but it's very good cardio. And you run around and move all the muscles during the process. But how about nutrition? I've seen some things you could eat that could help you with reduce the oxidation or oxidative stress that leads to gradual aging of people. And one thing that I've actually noticed is that some people that have used things like almond, in fact, there's a research that was done, and they put some people on almonds for 12 weeks. And they found out that among those who are taking almonds every day, compared to those who are not taking almonds at all, they noticed that those who are taking almonds every day had less wrinkle in 12 weeks compared to the other ones who are not taking almonds. So basically, almonds reduces your ability to wrinkle, which means it slows down aging. I actually tried this on my sister who's diabetic. I mean, she has type 2 diabetes, and I put her on I thought to take almonds every day to see how that will help her with decreasing her blood sugar. Actually, maybe it was almond, maybe it was combination of things. She did not lose her weight. Her weight is still the same. She's a little bit overweight. She's maybe 77 kilograms. And she's about BMI of maybe 28, 29, I would think. Yes. But she noticed that her A1C gradually decreased to the point where they have to take her off both insulin and metformin. And she has been so impressed that she takes it all the time. She actually believes almond actually helped her diabetes. Well, that is questionable. I don't have any scientific data to prove that. But I know that things like almonds have some antioxidants that help you reduce the stress your cells are having due to oxidative stress. Because when you have stress with oxidation, it makes the cells to die faster. And that's what aging is all about. So combination of oxidation on stress on the cells result in gradual and aging getting faster than it should. So, and one of the things that we know that increases oxidative stress is inflammation, whether it's inflammation through infection, whether it's inflammation through drugs and medication, whether it is inflammation through chronic diseases. And I know you know about chronic diseases includes peripheral vascular disease, obesity, diabetes, chronic obstructive pulmonary disease, smoking, and all that that affect your cells to work at optimal benefit for your body. Those things actually add up and result in aging faster than you should. I mean, there are some things that actually make aging faster, which include our DNA. You cannot change your DNA, but you can actually change your habits that will improve your lifespan. Maybe even if it's 5 years or 6 years or 7 years. Now, someone will say, "Oh, if I'm gonna die, why stay alive anyway?" But that is a question that has multiple answers. There are so many reasons to stay alive. If you're married with children, you want to stay alive to see them grow. And you are also a good commodity for the community. And life involves social connection. So you being alive makes somebody else's life easier, because if there's nobody around you, if we are all decide to be by ourselves and nobody to connect with us, I mean, life is going to be very boring and going to be very depressing. So your being alive, whether you like it or not, can make somebody else's life even better. So, and other parts of that I cannot just talk about right now, but what else do we do? We've talked about exercise, we've talked about some nutrition. We should talk about the things that we should do as human beings to help us prevent, whether it is cancer. There are some cancers that can be detected early, whether it is cervical cancer, breast cancer, prostate cancer, colon cancer. Make sure we do our test at the appropriate age. And I can tell you that, I should be doing the same, but I haven't done the way I should. So I also blame myself. I should do more on that aspect, but it is the right thing to do. There are some cancers that you cannot. There's nothing you can do about it. If you have pancreatic cancer, there's no special test right now that is available in general to diagnose that. But the ones that are very common, the ones we know we can, catch early and treat early, try to take care of that, because cancer is also something that causes death. It decreases lifespan. Is a continuous growth. Cancer is basically a growth in your body. Your body is growing faster than it should and consuming and destroying all part of your body until the person dies. It's basically taking over your system, and it's trying to run you down to death. And that's what cancer is. So in the end, we should try to work on things that we can work on and improve on things we can improve on, and eat the right food, stay away from alcohol, instead of drinking alcohol, because everybody knows that there's this saying that alcohol improves your health, your cardiac health. But why drink alcohol when you can take grapes, red grapes? Grapes, is like red wine. Grapes has other antioxidant effects that are more beneficial than alcohol. And whatever alcohol is going to give you, grape is going to give it to you. And drinking alcohol in excess destroys your body. Alcohol is a common cause of pancreatitis, liver disease, heart disease, dementia. I don't know if you've heard of alcohol dementia. It's called Wernicke encephalopathy and all that. So you don't want to get yourself drunk because you heard that alcohol helps the heart. That is not an excuse to kill yourself with alcohol. If you want the benefits of alcohol in your system, that little amount they say you could take to help your cardiac issues, then eat grapes. Eat maybe 5, 6, 7, 8 grapes every day. That will give you everything you need with your, to improve your cardiac function, but also give you the antioxidant that you need to reduce the oxidative stress that are affecting your cells. So thank you, and next time we're going to talk more about life in general and hormonal treatment. Thank you and God bless.